Hi, Sue. How are you?
Fine, thanks.
Good. We just finished your last session of the peripheral neuropathy and the laser, and I want to know how you're doing.
Much better from when I first started. My balance was so bad that I often used a cane just for my balance and had lots of cramping in my legs and feet prior to coming. And unfortunately, a week before I started coming, my medicine that I'm on had started attacking my fingers, and I was having a lot of trouble with my fingers, joints going in and out and being very painful. And it is all of that's improved. I'll maybe have one or two cramps in my legs or feet a day compared to when it was pretty much all day long off and on.
Okay. How are the fingers doing now?
Much better. I have one that is still really tender, but it isn't going in and out of joint like it had been. I'm not sure if that's exactly what was happening, but something that was very painful.
Right.
And pretty much my left hand, I really haven't had very much trouble at all with it lately.
Okay. And how are you doing with balance outside of the therapy we've been doing here at home? How are you doing with that?
Much better. I probably should tell everyone that I had a death grip on everything trying to balance when I first came in. Couldn't balance for more than 2 seconds at the very most. And now I do at least 20 to 30 seconds on each leg and don't have quite the death grip. And I'm no longer getting motion sick because it was so bad.
Good. So good.
But even my kids and friends have noticed that I'm much better.
Excellent. You had mentioned some cramping at night when you were trying to sleep and kind of like a restless leg. How is that doing?
Much better. Much better. Very, very seldom wake up with it.
Okay.
In fact, I think I had maybe one just a couple of nights ago. I did have a little trouble, but that was maybe the first in 2 weeks, 2 or 3 weeks. So
excellent. So how would you rate your overall improvement since when you started to today?
Oh, I mean, part of it isn't anything you could have done anything about,
Mm-hmm.
but I'd say probably 80%. I feel like it's
Good.
Greatly improved.
Excellent. Good. So we've given you some exercises and things like that to do at home. I want you to make sure you continue to do those as well.
Right.
Okay, and then we'll check things in about a month and just kind of see where you're at.
Okay.
Sound good?
Sounds good.
All right, thank you.
Thank you.